Hi guys, my name is Zachary Binkowski, and I am a critical care pharmacist. I'm joining the Do Influence project here, and I have the list of questions to go through to get to know a little bit about me. So, question one is: what kind of pharmacist am I, and what type of training did that involve? So I'm a clinical pharmacist, as I mentioned, and more specifically, I'm a critical care clinical specialist who focuses in critical care. Essentially, I'm the ICU pharmacist. So to become a registered pharmacist, you all kind of have to go through the general aspect of going to pharmacy school, but there are a couple of different ways, um, different roads you can take to get there. There's three general styles of how that happens. There's what's known as a 2-4 program, a 0-6 program, and a 4+3 program. So I'll go through each of those. So a 2-4 program that's what I did, and I went to the University of Connecticut. That's where you do 2 years of pre-pharmacy as an undergraduate, and then you apply in your second year of pre-pharmacy to the pharmacy school. And if you get in, then it's 4 more years of training in the School of Pharmacy. Other schools, like the University of Rhode Island, for example, they do a 0-6 program where you're admitted right into the School of Pharmacy from high school, and then you have to maintain a certain GPA to stay within the school, but you're in the pharmacy school right from high school. And then the third option is popular with people who have other degrees already. You have to have a bachelor's degree in usually one of the sciences, and then you apply to these schools, and they're like an accelerated 3-year program, which ends up with you getting your doctor of pharmacy. So again, those are the three different kind of tracks you could go to go through pharmacy school. So like I said, I went to UConn in a 2-4 program. I got early acceptance to the University of Connecticut at the store's main campus, but I decided, since I knew that I kind of wanted to do pharmacy, that it's going to be 6 years of school, and that can be very expensive, to do my first 2 years at a branch campus at Avery Point in Groton, Connecticut. So that was great for me because it was 20 minutes from where I grew up, so I could stay with my parents and sleep in my own bed at night. And for me, that fit well, and it was a great cost savings choice. So I did my first 2 years there, and then I moved up to the main campus because that's where the pharmacy school is located. At this point, for those of you who are looking at different size schools, one thing I wanted to mention is that the University of Connecticut, UConn, it's a pretty big school, but it's only as big as you make it. So, once I was in the pharmacy school, I did pretty much everything with the same 100 peers. We all took the same classes together. So it was almost like a high school mentality feeling where, you do everything with the same 100 people. Um, like I said, if you wanted to get involved in other organizations and do activities across campus, it could be as big as you want or really as small as you want. Um, so things are slightly different now than when I went and got accepted to pharmacy school. So the way they are now is that during your second year of pre-pharmacy, you have to take the PCAT test, the Pharmacy College Admissions Test. So it's similar to how pre-med students take the MCAT exam. And then there is a pharmacy school interview process. But it was a little bit different for me. So, so back to me. When I was in school, after the 2 years, I got into the School of Pharmacy. And then after 2 more years, so after 4 years total, I earned a Bachelor's of Science in Pharmacy Studies. And I think this is a really great strength of the program because to earn a bachelor's degree, you have to meet a certain number of general education requirements. So you've been exposed to many different subjects. It makes you much more well-rounded. And many of the other pharmacy schools do not do that. So it's one of the pluses of UConn. And then after 2 more years, I earned my Doctor of Pharmacy degree. The last year, so year 6, is made up of 9 1 month clinical rotations that are set up and diverse throughout the state. So once you earn your PharmD, that doesn't make you a real pharmacist yet. You still have to take 2 big exams. One of them assesses your clinical and drug-related knowledge, and the other one is a law exam, and you have to pass both of those tests in order to become a registered pharmacist. Now, I personally knew that I did not want to go into retail pharmacy, which is like community pharmacy, like CVS, Walgreens, kind of thing. Um, so I applied during my last year of pharmacy school to do a pharmacy practice residency, which is the traditional road that you would take if you wanted to get a position as a clinical pharmacist. So, like physicians, pharmacists can do residencies. Generally, you'll do a first year clinical pharmacy practice residency, and then there are a variety of second year residencies that are in different subjects like critical care, emergency medicine, pediatrics, infectious disease, oncology, uh, tons of different second year residencies that are out there. However, this is kind of where my path kind of deviates from the traditional road that one might take. I interviewed at a variety of places, but I did not match with a program for residency. So that was kind of a rough day, match day, when I didn't match, and I didn't have any luck with the post-match scramble. But while I was interviewing for residencies, I also interviewed at St. Vincent's for a staff pharmacist position as kind of a backup plan. And I'm lucky that I did because that's the way the cards kind of fell, and that's the way I went. So I got hired on at St. Vincent's as a staff pharmacist. And back then, as a staff pharmacist, it was a rotating model where, depending on the day you were assigned to a different job, you could be the chemo pharmacist one day, covering the ICU the next day, the general medicine pharmacist, one day, and pretty soon I got a feeling that, I had a flair for critical care and I really enjoyed critical care. And eventually, I kind of went out of my way to join committees in critical care to really round with the team up there. And soon enough, I became like the unofficial ICU pharmacist. And then after 2 years, they kind of created the position that I have. And I was the first critical care, the first clinical specialist position for pharmacy at St. Vincent's in critical care. So, I like to say, I went from not doing formal residency to becoming a preceptor for a pharmacy practice residency program within 2 years. Because when I got the position, the clinical position. That year, we also started our own residency program at St. Vincent's. Um, One other thing that I did to make myself kind of stand out so that I was viewed as equivalent to having done a residency is that I became board certified as soon as I was able to sit and take the exam, and I passed. Um, so just again, like physicians, you can be board certified in many different specialties. And I'm a board certified pharmacotherapy specialist. There are critical care boards available, but those didn't come out for a few years after I took my initial boards. So it's still up in the air whether or not I'm going to sit and take those. At this point, I don't know if it would add added value really to what I do, but that's a different discussion. Um, so moving on to question number 2. Can I tell you what a typical day looks like for me at work? Okay, well, I get up pretty early, and in the morning, I get there and I get sign out from the night pharmacist. I print my patient list, so all the patients who are in the ICU, the progressive care unit, and the cardiovascular unit. So those are all my patients. I collect the drug monitoring sheets. So pharmacists at St. Vincent's, we do a lot of therapeutic drug monitoring, and we have a lot of protocols set up for different drugs. For example, with some of the antibiotics, if a provider wanted to start a patient on an antibiotic like vancomycin, all they would have to write an order for was vancomycin per pharmacy protocol, and I kind of take it over from there. So I do the dosing, calculate the frequency, check the renal function, order the labs, kind of run the whole show from there. So at that point, I go up to the unit and I go to the intensivist sign out. So an intensivist is a physician who specializes in intensive care. So those are the ICU doctors. So I listen to the night intensivist give report to the day shift intensivists. So I get a better understanding of the patients, especially those new patients who came in overnight. And then I go through my patients, I review their labs, I review all the drugs that they're on, make sure all the meds are appropriate for their kidney and their liver function. So to make sure they can metabolize them all, to make sure they're all dosed appropriately. Another huge thing that takes up a lot of my time is what's called antimicrobial stewardship. So that's where I look at antibiotics that patients are on and look at their cultures to see what they're growing and see if the antibiotics are appropriate for the bacteria that may be causing the patient's infection, and see if I can either de-escalate therapy, meaning switch from using an antibiotic that treats like kills a whole bunch of different bacteria to one that's more narrow spectrum targeted therapy. The reason for that is to help reduce development of drug resistance, and as a cost savings initiative as well, and to prevent overuse of some of the broad spectrum agents. Then I round with the teaching team. So St. Vincent's is a teaching hospital. So I round with the attending physician who's an intensivist, third year medical student, second year medical student, first year intern, myself, a pharmacy resident, pharmacy student, and we go room to room and do bedside teaching rounds. I also respond to all medical emergencies and cardiac arrests. At codes, I prepare all the meds from the code cart. And then throughout the day, I'm also verifying all new orders that get put in and placed on my patients to make sure that they're appropriate. Another huge part of my day is involved in teaching. So I teach pharmacy residents as well as pharmacy students. And I also teach at the medical school at Quinnipiac. Um, I teach some of the pharmacology to the first and second years. So teaching is a passion of mine, and it also is a large part of what I do. Okay, so moving on to question 3, what made me go into pharmacy? So I mean, I knew from early on in high school that I wanted to do something in the medical field. My mom is a nurse, and my father is an engineer, so it kind of seemed like pharmacy was a good blend of the two. I also have an aunt who is an oncology clinical pharmacist, and I had many opportunities to shadow her when I was a student, and to really kind of get a taste for what she did, and pharmacy really kind of really grasped my attention uh, in those formative years of high school as something that I look forward to. Um, so by the senior year of high school, I was pretty sure I wanted to be a pharmacist. Um, you know, that was all kind of second choice because you see, I never ended up getting my Hogwarts letter. But I thought being a clinical pharmacist was as close as I could get to being a potions master with kind of a flair for defense against the dark arts. So I went to pharmacy school. So, question number 4, what courses were most beneficial in high school? So, I would say the sciences, so biology, chemistry, physics, and anatomy and physiology. Um, Also, the humanities are also incredibly important. I took classes like social psychology, um, history, current affairs. Those are all also very helpful and relevant. Um, so the pharmaceutical sciences in general kind of build off the core basic science disciplines. So they undergo what I call like the pharmification of the sciences. So biology turns into pharmacology, chemistry becomes medicinal chemistry, physics becomes pharmaceutics. So each of the basic sciences has its own direct application um, in pharmacy. So, number 5, what extracurricular activities did I participate in outside of regular coursework? So, number 1, I had a job. I worked at my local library all through high school and much of college. I started out as a librarian's assistant and ended up as the assistant children's librarian towards the end of my time there. I ran the summer reading program. I absolutely loved it. So now I'm going to share a little secret with you guys. I never actually had a paid job working in pharmacy until after I graduated pharmacy school because I loved my job at the library, and I spent almost 8 years at the library, and I used my time there and my work there um, to my advantage when it came to interviewing for pharmacy. So, as a librarian, you do deal with a lot of research and information and answering questions and dealing with the public, all very similar to, working in pharmacy from that regard, um, but almost at a broader level. So, as a pharmacist, you get asked all sorts of drug information questions. Well, as a librarian, were asked you know, questions from any topic, that a patron might have a question about. So before the advent of Google and Wikipedia, back in the day, if people had obscure questions, they could call the library and ask them, and then it would be the librarian's job to find the answer for them, using books. I know it seems such a Stone Age concept at this point. Um, so I used those central tenets of dealing with the public and doing research to my advantage when interviewing for positions, because the library gave me such a broad foundation, um, for any kind of work I might have found myself going into. So, an important thing to think about is no matter what kind of job you have, look at some of those general principles of the job and see how they may be applicable to talk about when interviewing for another position. So number two for extracurricular activities was volunteer work. So I did quite a bit of volunteer work. I worked in hospitals. I was a runner in the emergency department, um, you know, getting supplies, running down to the pharmacy, picking up meds, bringing them up to the ED. Um, Later on, I did more of like medication reconciliation work in the emergency department as a volunteer, and as well as things like volunteering at flu shot clinics. I did a lot of that as well. So, question number 6: how did I maintain focus to study and prepare for my exams? So, with this, I would just say organization is the key, and scheduling breaks is important. So, for every hour and a half of studying, you have to take at least 20 minutes to do something else, clear your head before you come back and study some more. I am proud to say that I never pulled an all nighter in my entire college career. So I guess my organization worked out in that regard. Nor did I buy any illicit substances to help me with studying, like Adderall or Ritalin. In fact, some people may say I'm a bit of a killjoy because when I was in pharmacy school, I actually reported the illegal sale of amphetamines by one of my classmates to my other classmates while in the school. And, from my viewpoint, how could you be a future trusted member of the pharmacy profession if you are already illegally selling drugs? So that didn't really kind of mesh with my own moral philosophy and my own kind of beliefs about the pharmacy profession. So that's another little side story. I have a lot of many interests outside of pharmacy, including history, philosophy, language, things like Greek and Roman mythology. Um, in fact, like 4 years after graduating with my PharmD, I went back to school and I got a master's in philosophy and healthcare ethics. Something a little bit different to make me stand out. Also, to kind of help me because I was working in the ICU or deal with a lot of different difficult ethical situations that would arise, and I wanted new and um, different ways to approach those problems. Um, and I wanted to add something else to my CV or my resume, um, to kind of fill that void left by the fact that I had never done a residency myself. So with that, master's degree, I serve on the hospital ethics committee, as well as on my city's board of ethics. I mean, healthcare ethics is a growing discipline. Just look at the pandemic and the scarcity of certain resources and drugs and ventilators, and figuring out, morally who should get what is a mix of medical science and moral philosophy. So it's something that really interests me. An achievement that I am proud of and very honored to have achieved is I was named the St. Vincent's Medical Center Employee of the Year back in 2018. So out of about 4,000 employees, I was chosen through various nomination letters as Employee of the Year, and that was um, I was very honored. It was a very touching moment for me. So next I have here, what are some keys for success? So each year I interview candidates for the pharmacy residency program, and I ask them about some of their passions outside of pharmacy. Things that really excite you that you could talk to anyone about. I found that some of the best pharmacy residents and pharmacy students that I've had are those that are well rounded, who can talk to anyone about anything. Ultimately, communication skills are the key to success. And the more well rounded you are, the easier communication becomes, and you can find common ground um, to bond with someone over. So it helps, as a clinician, as a pharmacist, to build a relationship with your patients, as well as between yourself and your coworkers. And really, communication skills are key. And if you just focus on, pharmacy, 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 you're going to be a rather dull person to interact with. Um, so you have to have passions. It's totally okay to be passionate about pharmacy, but it's great to have more than one area of deep interest. Um, and learning about people's interests also is fun, and you get to learn quite a bit about people. And this all again ties back to communication skills being key. Now, another tip that might sound a little bit crazy at first is to try and understand yourself a little better. So by that I mean, like, take some personality tests and personality assessments, like the Myers-Briggs test, for example. Um, so you kind of learn a little bit more about your personality type, and also take some assessments that look at the best way to which you learn, if you don't know already what kind of learner you are. And once you kind of isolate the best way that you can learn, and you apply that, um, you know the better at learning and the more learning and knowledge retention you'll have. Because life is really, it's a never-ending learning process, and it, you want it to make it as good a ride as possible, and as smooth as possible, by knowing the best way that you learn. So, thank you guys for having me be part of this Do Influence project. And if you have any other questions for me about my career thus far, or how I got here, please feel free to reach out to me. And you can email me, and I'll be happy to answer any questions that you guys might have. So thank you very much.